Hello everyone. Our today's topic is arthritis. What is arthritis? Whenever there is inflammation within arteries or arterioles, that can occur either due to infectious or non-infectious cause, we call it as arthritis. Now, the infectious arthritis, remember the infectious arthritis, there would be direct invasion by the pathogen like bacteria and the fungi, whereas the non-infectious arthritis, that is also known as vasculitis, and it affects the smaller vessels like arteriolars, venules, capillaries, etc. Remember that immunological factors like the autoantibodies such as anti-neutrophil cytophilic antibodies and anti-endothelial cells antibodies, they are implicated, they are involved in cases of non-infectious arthritis. The first we are going to discuss is syphilis arthritis. Syphilitic arthritis, it predominantly affects the ascending aorta and the aortic arch. It occurs during the tertiary stage of syphilis. So you will see the aorta would be dilated. The aorta would be dilated and it have a thickened walls, and it is characterized by a pearly white thickening as it resembles as the tree bark. So it resembles the tree bark. On microscope you would see is endarteritis and periarteritis. Along with that, you will see immune cells and dense collagen thickening. The other is cerebral syphilitic arthritis. That is, other name is Hubner arthritis. So here small to medium size vessels, the cerebral arteries, they are affected. So on grossly, the affected vessels, they would appear white, rigid, thick. So similar conditions they are seen in syphilitic arthritis that lead to brain atrophy due to the reduced blood flow. Now let us discuss the non-infectious arthritis. The one of example is polyarthritis nodosa. So remember, the polyarthritis nodosa, it is a type of necrotizing vasculitis that involves the medium size muscular arteries across the multiple organs. So it will affect the adult. Mainly affected they are males. So there would be systemic symptoms. One you can see is fever, malaise, weakness and weight loss. Apart from that, organ involved manifestation that you can see is renal involvement, like you can see albuminuria, hematuria or the renal failure. Apart from that, you can see is abdominal pain, peripheral neuritis and hypertension. So on gross finding, you will see that the lesion in this, they appear as tiny beaded nodule. On microscopy you will see three stages: acute stage, healing stage and the healed stage. So in the acute stage you will see fibrinoid necrosis that occurs within the vessel wall, and you will see acute inflammatory cells like dominated by neutrophils, eosinophils, mononuclear cells that could be seen. In the healing stage, you will see fibroblastic proliferation. So the inflammatory infiltrate here includes lymphocytes, plasma cells, and the macrophages. And the healed stage, it features with the dense fibrosis with the loss of the internal elastic lamina. And apart from that, hemosiderin-laden macrophages that could be seen. The other condition is hypersensitivity vasculitis. So it is also known as allergy or leukocytoclastic vasculitis. So here you would see is inflammation of venules, capillaries, and arterioles. So this condition, it differ from the polyarthritis nodosa, that in that it primarily involves the small vessels and it is associated with immune response including streptococcus virus, drugs, chemicals, etc. So on the histologically, you would see fibrinoid necrosis with the neutrophilic infiltrate within the vessel wall. The other is the Wagner granulomatosis. So the Wagner granulomatosis, it is a form of necrotizing vasculitis that is characterized by triad. There would be upper and lower respiratory tract involvement, that it involves the nose, sinuses, and the lungs. Apart from that, there would be necrotizing vasculitis. So there would be focal necrotizing vasculitis that affects the lungs and the respiratory upper airway. Apart from that, you would see is glomerulonephritis. The condition is more prevalent in the males and it involves the multiple organs like the lungs, paranasal sinuses, nasopharynx, and the kidneys. So one symptoms you may see is symptoms that you may notice is pneumonitis, chronic sinusitis, nasopharyngeal ulceration, and the kidney or the renal diseases. Apart from that, you would see is circulating immune complexes like, so this one suggests autoimmune basis. So on histologically, you would see is necrotizing granulomatous inflammation in the tissues that would be associated with the granular formation. The other condition is temporal, that is known as giant cell arthritis. So it involves inflammation of medium and large arteries, particularly the temporal artery, and it is seen in patients over 70 years of age and it is seen in females. Slight female predominancy. So patient would complain of headache and potential blindness in case where ophthalmic artery is involved. So the affected artery, you would see it will appear thickened and it would feel like cord like and will have a narrow lumen. So the most common feature that is presence of giant cells or presence of Langhans type cells that could be seen. So there would be cellular proliferation that lead to lumen narrowing and that could lead to thrombus formation. The inflammatory cells that could be seen are neutrophils, lymphocytes, eosinophils that could be seen. The other condition is Takashsayu arthritis. It is also known as pulseless disease or aortic arch syndrome. So it is mainly characterized by granulomatous vasculitis and it primarily affects the aorta and its major branches. So this condition, remember, it primarily involves the young woman and it is associated with the symptoms such as absent pulses in both arms. There would be ocular manifestation. Ischemia can occur due to thrombotic occlusion of the vessels that could lead to MI, that is myocardial infarction. So here you would see there would be inflammatory changes in the adventitia and the media part and granulomatous changes that may be seen with the central necrosis. Apart from that, Langhans giant cells that could be seen. The other condition is Kawasaki disease and it is known as mucocutaneous lymph node syndrome and it primarily affects the young children and the infants. So here you would see is fever, there would be conjunctival involvement, skin rashes and the lymphadenopathy. So it is characterized by fever. The mucocutaneous manifestation you see is oral mucosal erosions, conjunctival involvement of skin rashes could be seen, lymphadenopathy could be seen. Now the hallmark pathological feature of Kawasaki disease is pan-arthritis. Resembling that is seen in polyarthritis nodosa. So there would be necrosis, inflammation across the entire thickness of the vessel wall, development of multiple aneurysm, particularly in the coronary arteries, which you can detect in the angiogram. The other condition is the Buerger's disease, that is also known as thromboangiitis obliterans. So it is a vascular disorder, remember, that affects the small and medium sized arteries. So it is, remember, this disease is associated with cigarette Smoking. So it will be more seen in the men who are smokers, and it occurs by age of 35 years. So your symptoms that you would see is intermittent claudication due to ischemia. There would be intense limb pain, and that is why it would affect the legs. So in advanced stage you would see is gangrene, so Burger disease, it is closely related to heavy cigarette smoking, suggesting a role of tobacco related endothelial damage and the hypercoagulability. The genetic factors that also play an important role, it involves the HLA9 and HLA-B5. Other condition is, remember, it's rheumatoid vasculitis that affects the small and the medium sized arteries in the multiple visceral organs. SLE primarily affects the small arteries of the skin. Other is Raynaud's disease. It affects the small arteries and arterioles of the extremity in the young healthy female. So it is triggered by, remember, it is triggered by cold, stress, hormones, or certain medication. So clinically you would see pallor, cyanosis, the digits would be reddened. Now let us discuss some MCQs. Which of the following disease primarily affect small and medium sized arteries and veins of extremity, and it is strongly associated with cigarette smoking? So the cigarette smoking is associated with Burger's disease. The other name of Burger disease is, remember, it's the thromboangiitis obliterans that affects the small and medium sized arteries and the veins in the extremity, and it is seen in heavy cigarette smokers. The next question is, which vasculitis primarily affect the children and infant presenting with mucocutaneous symptoms, fever, and potentially coronary artery aneurysm? The answer would be Kawasaki disease. So it is characterized by illness with mucocutaneous symptoms that primarily affect the children and the infant, and can lead to multiple aneurysm, particularly in the coronary arteries. Next question, which type of vasculitis is characterized by necrotizing inflammation of small and medium sized muscular arteries across the multiple organs, typically affecting adult and more commonly seen in males? The answer is polyarthritis nodosa. So remember that the polyarthritis nodosa, it is a necrotizing vasculitis that target the small and medium sized muscular arteries, and it is more common seen in adult males with symptoms of organ specific manifestation like the renal and the peripheral neuritis. Which vasculitis is associated with granulomatous inflammation, primarily affecting the aorta and major branches? The answer is Takayu arthritis. It is characterized by granulomatous vasculitis affecting the aorta and major branches and affect the young woman. Which vasculitis is associated with functional vasospastic disorder affecting small arteries and arterioles of extremity, primarily triggered by the cold response? It's the Raynaud's disease.